Hi, good morning. This is Laves-Webb, and I'm really excited to be sitting here this morning with Senior Associate at the practice, Nick Mamey. Good morning, Nick.
Good morning.
Good morning. And we're gonna take some time and really kind of dive into getting to know you a little bit more, and for folks out there to learn a little bit more about kind of your specializations, your area of interest, a little bit more about your background. And so, really excited to be having this opportunity. Tell us, let's just start with, tell us a little bit about your background and kind of some of your areas of specialization and what you're bringing to the practice here.
Sure. So I've been practicing in the field, I guess, for the past 7 years.
Okay.
And I like to work primarily with people who experience PTSD, anxiety, ADHD. These are all fields that I specialize in. And
Okay.
yeah.
Okay, so PTSD, anxiety, ADHD.
Mm-hmm.
Is there any particular modalities that you use and to help treat those kind of presenting problems or symptoms in folks?
Yeah, so primarily I like to use CBT and IFS. Each person's different, and it does kind of depend on what that person is going through and what they respond to as well.
Can you elaborate a little bit on CBT and IFS and kind of what those are for the folks out there?
Sure. So CBT is cognitive behavioral therapy, and that works with your thoughts and behaviors in a way that addresses the changes that you want to make, okay, in your life. And IFS is internal family systems, and that looks at the family structure that you grew up with and how you internalize that and how that presents in your life today and within yourself.
Interesting. So you're looking at both the thoughts. It's raining this weekend. That means it's going to be a bad weekend.
Sure.
And it's raining this weekend. I remember when I was a kid with rain and kind of what that meant.
Right.
So
right.
you're looking at both the past and almost the future.
Right. And that's something I really like to incorporate, especially early on in therapy, is getting to know the families that they grew up in, what that looked like, how they were raised, and the habits we learn and form from that upbringing.
Okay.
So that's, yeah.
Okay, wonderful. And then for folks out there, what would be, if they're thinking about, hey, man, I'd like to, potentially see Nick here, what would be your ideal client, or who might really kind of line up best in terms of working with you specifically?
Sure. I see all different types of clients. I think my ideal client would be someone who's willing to be open and vulnerable and want to engage in the process of therapy.
Okay.
So,
okay.
Yeah.
Okay. And when you say engage in the process, what we talk a lot about process, in our field, but what does that mean for someone who may not know the process of therapy? Can you say a little bit more about that?
Sure. So, when I say the process of therapy, I see therapy above anything else as a relationship. It's a process of building trust and rapport with that person. And that's where the most amount of healing can come from.
Okay, gotcha. So you're really talking about the therapeutic relationship.
Exactly.
Yeah. And the research shows that, irrespective of CBT or IFS or any other kind of theory, the therapeutic relationship is the best indicator of a successful outcome.
Right,
so,
absolutely.
Yeah, so
absolutely.
It makes sense. Okay, thank you. And then is there anything kind of about you as a person, or where your background some that you think people could really benefit from knowing about, or that you'd like to let people know?
Sure. So prior to being a therapist, I studied religions, theology, spirituality, primarily from a Christian context. And Christian counseling is something I offer to clients who want that as part of their therapeutic experience.
And you studied that in academia, correct?
I did, yeah. So I have 2 other master's degrees in theology and divinity.
Wow.
So.
That's fantastic. And were you thinking at that point that maybe you'd go into more of I don't know, the priesthood or something of that degree, and then or was that kind of the thought, if you don't mind?
Yeah,
asking?
yeah, absolutely. So that was kind of the trajectory I was on, was to to be a priest. And it wasn't until, you know, I was almost done that Bishop in New England asked me to write a book with him on marriage. And he had his doctorate in counseling and had been counseling couples for years. So we worked for 2 years together. And he's a widower and had just wealth of knowledge.
Yeah.
And I was, you know, starting to apply for PhD programs, and after working with him, he was like, you know, you seem to really like people and be engaged with people. Why do you want to be locked up in a library for the next 5 to 6 years?
So he really saw in you and kind of was a mentor in that way of, hey, I think you could be really good and contribute a lot to people's lives.
Yeah, it took him 2 years to convince me, but I got there. You know?
Fair.
Yeah.
It's interesting how our lives kind of the shape that they take, and
Absolutely.
you never know what influences you. I know I was in law school for a minute.
Okay.
Myself. So I think for 2 days, and then decided, no, that's not it. I really want to go into the field of psychotherapy. So.
Well, you're less stubborn than I am.
I thought about it for 2 years prior, trust me. All right, well, welcome so much. Thank you very much for taking the time to get to know you.
Yeah, and thank you, and I appreciate it.
Okay.
I hope to see you guys soon.
Okay, you bet. Bye.